Something that you guys promote a lot on your Instagram, which I find fascinating, is this vaginal rejuvenation shot. What is that?
So that is something that we do here. That's actually something that my colleague does, Dr. Wynn, who does a lot of that because she's an OBGYN, who
Mhm.
happens to also be my wife, who does a lot of these cases. So it's nice because we'll do a lot of these mommy makeovers where we're
Mhm.
addressing not only the tummy, but if they want what we call maybe the full mommy makeover, she'll step in that case and start doing what she needs to in that area. So vaginal rejuvenation shot is basically taking, we sometimes use filler, just like you would use in the face. Filler to fill in that certain area in the vaginal cavity that's known to kind of hold the G spot.
Mhm.
When you fill that area up with all those nerves, you kind of bring it to the forefront a little bit so it's more accessible during, intimate times with your partner. So you're kind of just building it up so it becomes more able to be sensitized during the act, I would
You
say.
have a better orgasm.
You're correct.
Yeah.
And so it's the G spot for a better orgasm. They can also take your own blood and spin it down for the protoplasm and the stem cells and use that also because that's a part of your own body. It's going to stay there forever. And that helps boost the ability to have an orgasm better in the same way that the filler does.
Wow. So, and how long did that last? Like, how many shots do you have to get?
So typically it's just one shot, and I believe, and I had to double check, but it can last anywhere from 6 months to a year. So
Wow.
if you like the way it's feeling and it's working, then you would need a touch up, maybe at 6 months to a year.
Do you have to go under for that? So, or are you awake for them doing this?
So normally, if we're doing it in a combination procedure, you can be asleep while Dr. Wynn steps in to do that. Makes it really great. However, if that's the only thing you're coming for, then she does it in the office. That area tends to, at least in that particular area, she can do it where it's not particularly uncomfortable, as long as you get some medications on board, and does it right here in the office.
Amazing. Okay. And is that becoming popular with you guys?
Yeah, we see a lot of that, a lot of women who are wanting those sorts of increases in stimulation and orgasm in addition, because usually it's not done isolated. We're doing other things
Right.
like labioplasty or vaginal tightening, where labioplasty is obviously tightening and making the outer portion of the labia look a little bit more trim and uniform, removing excess skin. And a vaginoplasty is you actually go inside the vaginal cavity and tighten it up because some people, when they've had children before, these areas get stretched out and they don't necessarily snap back. And so, a lot of this is Dr. Wynn will talk to them about, what's their quality of their sex life, what's the husband saying, those sorts of things. And so that's how she'll determine what needs to be done from a G shot to vaginal tightening or the outside aesthetic.
I'm curious, does the vaginal tightening also help with, after you have a kid or age, like sometimes you can pee when you sneeze or laugh?
Absolutely. Absolutely. So these are all things because the pelvis loosens entirely when you have a baby because things are being stretched. And so what happens is women get a lot of not only you describe urinary incontinence, that means sneezing, bearing down, you pee when you don't want to, but they get fecal or they have a little bit of, poop staining, for lack of better words, because they've lost the ability to contract those sphincters like they were able to do before children. So she does a lot of that work to help tighten those areas. But vaginal tightening can actually improve some urinary incontinence. But again, I leave that to the expert. My wife, Dr.
Yeah.
Rejuvenation is what we call her, to help you in those parts. And it's great because she's an OBGYN by training. She's been down there way more than I have in the sense of, being a doctor. I'm up here, right? I could tell you everything that needs to be done from, the chest, the tummy, the back, the butt, but she's the expert in that area. So it's nice to have her close by and we can do these, procedures together and people really enjoy them, love it. And they're improving not only their self-confidence about their body, but also their sexual gratification with their partner and really can restart these love affairs, I guess, for these families and husbands and wives.
Fascinating. I have a question about your male patients. Do you have
Yes.
any? And like, what is the percentage now? I read that, males make up 15% of patients in 2023. What are they doing? What are you working on with them?
So we do have male patients. I would probably say about 15 to 20% of my population is male. And we're kind of seeing them for a variety of different things. One is, with Ozempic, I mean, not only are women taking Ozempic or semaglutides, including Mounjaro, they're losing weight just like women are losing weight. And so we're seeing more men come in for tummy tucks, right? Men typically don't come in for tummy tucks, but they're starting to see all this weight loss and a lot of loose skin down there. So we're starting to see more tummy tucks, men coming in for removal of that loose skin after losing a lot of weight on semaglutides. So tummy tucks are becoming more frequent. Liposuction's been something that we've kind of been seeing for the most part, but we're probably seeing a little bit more with the weight loss. People want to see more etching, more definition in their
I was
abdomen.
just going to ask you about the etching. How do you do that?
So that is just through liposuction techniques. So
Oh,
essentially what you're trying to do is you take liposuction, and I'm going to show you because I even brought this here too. So
great.
if you want to take a look, this is a liposuction cannula, right?
Mm.
So this is what it's attached to. This is a brand name of a particular liposuction cannula that vibrates. It's got a little on and off switch right here, but it'll shake the edge of this area or shake the cannula so it's easier to pass through the tissues because that slight vibration lets it slip through. Also decreases the fatigue on the surgeon because it's much easier to move around. But
Right.
the end of the cannula, again, is just sucking up fat. It's right there. It goes through these little holes. And what you're trying to do is create differential areas where there should be depressions and should be a little bit elevation. So when you think of the six pack or the rectus muscles, even women, the lateral part of your muscles, right? The outside of your rectus muscles, most women, most men have that when they're in pretty good shape. I want to take that down so it's really, really thin. So if they have a little extra fat, you take it down so it's really basically maybe half a centimeter. Right next to it, you're going to leave a centimeter. So you're trying to create this depression where it should be and enhance it by making it even thinner and making sure right next to it you have the normal sort of fullness where
Right.
you should see fullness over the muscle proper. So it's
You don't
basically
necessarily need to do implants or something. I always thought that these
no.
people have implants and
No. Yeah. I mean, there are some people who perhaps have started fat grafting, just like we do fat grafting in the butt, have started fat grafting the muscles, inside the rectus muscle. I
mm,
would say that's not been super popular, but the best way to create a six pack in someone who's already pretty healthy is to liposuction the inscriptions, right? We're trying to liposuction the lateral part of the rectus, which is the semilunaris, the linea alba, which is a midline depression above the belly button, and the inscriptions of the muscle, which kind of create the six pack. You take those down, you're going to look like you have a six pack. And
right.
so it's just simply liposuction technique is what we do when we do high definition.
By the way, how long have you been doing all this?
Been doing this for about 15 years. Probably the first 5 years of my practice, I did a lot of breast reconstruction for women who had breast cancer. So I kind of got going a lot with that. But as I sort of transitioned my practice just to cosmetics, started just focusing on body, breast and that sort of thing. I ended up kind of moving away from the breast cancer, which is great. I really found it gratifying. But as any surgeon, any doctor will tell you, sometimes fighting with those insurance companies is not fun.
Mm,
Sometimes it was just hard because you're working really hard and sometimes they wouldn't pay for certain things. And you could talk to any doctor, a pediatrician, they'll tell you the same story.
yeah.
But I'll still have them occasionally, but it just got so popular that people kept coming for more of the cosmetic stuff. I didn't have time for those other things. So that's
Right.
kind of how I transitioned just to doing what I do today.
That thing you were showing me for the liposuction, that
Yeah.
looks incredibly interesting and hard
Yeah.
to use. I'm just curious, this is so random, but like the very first time you had to stick this into a person,
Yeah.
were you freaking out? I mean, that must feel so strange.
You get so much practice in training.
Yeah.
And remember, you go through general surgery when you're training, even before you do plastic surgery. So I'm doing things like having my hands inside someone's abdomen, feeling the liver, the stomach, sometimes the heart, and all these things. So you're doing some real like surgery in those cases. And then as you start going on to plastic surgery, um, you sort of have that foundation, but nothing's as crazy as trying to hold your hand around someone's heart and beating it for them because they got shot, by a gang. To me, that was really hard and sometimes scary, and your adrenaline's rushing. So when they tell me, okay, just take this little cannula, I've already done the hard stuff, right? So
Right.
this part is not too hard. And yes, it takes skill and it takes years and years to get really good at this. So I don't want to mistake anybody for thinking this is easy to do. You have to be experienced. You have to look at your results and understand what you're doing, because there are a lot of bad liposuction results out there. And that's
Right.
because maybe someone's taking it too lightly, they're being too aggressive. And so it takes a long time to get really good at this. And I still learn to this day with various patients like, oh, okay, I would have done this a little bit differently. I'm going to start doing this now. So even after 15 years, I still make changes every time I operate when I look at a post-op patient.
Right.